Welcome everyone to our webinar today. We'll get started in a few minutes. In the meantime, we'd like to invite you to introduce yourself in the chat. We'd love to see your name, org title, and we know that we are all working in August when many people vacation. So if we can't be vacationing right now, let's maybe reflect on our favorite vacation spot in the last year. So my name is Shannon R.I.S.E, Director of Counties R.I.S.E, and I visited Santa Fe, New Mexico a couple months ago, and it was quite lovely. So would love to hear about some of your favorite vacation spots in the last year and see who's on the call with us today. We'll get started in just a few minutes. If you just joined us, we're inviting folks to introduce yourself in the chat. Okay, someone took a camping trip in the high Sierras. Niagara Falls. Stunning, stunning place to vacation. London, our first international reference. Oh, Las Cruces. Also, very beautiful spot. Especially this time of year with the monsoons. I love the purple and the orange and the earthiness of it all. I've yet to be to Utah, but it's definitely on my bucket list. Ooh, Sycamore Hot Springs Resort near Cambria. Hawaii, also soft spot in my heart for Hawaii. Welcome. If you just joined, we're inviting folks to introduce themselves in the chat. And if we can't be on vacation today, since we are all working, let us have a moment where we reflect on our favorite vacation spot this past year. And we'll get started in just one more minute. Costa Rica, pura vida. That's the saying down there. All right, well, I think we can go ahead and get started. Thank you, everyone. Those who are joining, if you just joined, please feel free to introduce yourselves in the chat. And welcome to our webinar today, where we're talking about county perspectives on Medi-Cal policy changes, and we're showcasing emerging insights from our county's R.I.S.E project. And I will toss it on over to our CSAC partner for a welcome and orientation.
Thank you. Good morning, everyone. I'm so happy to be here and see all of you. I'm really inspired to take a vacation now, seeing all of those lovely recommendations. It is the legislative recess for us here in Sacramento, so it's a really good time to think about visiting parts of our great state. I'm Jessica Sankis. I am CSAC's Principal Fiscal and Policy Analyst. So we have a really mixed group of folks registered to attend today, which is fantastic. A lot of folks from county land across the state, some folks from academia and nonprofit space. Welcome all. So CSAC, we are the California State Association of Counties. For those of you who aren't familiar with us, we are an association that represents all 58 counties, the unified voice of all 58 counties, and we were founded about 130 years ago, which was really exciting. So our acronym is pronounced CSAC, which you're going to hear probably throughout the rest of the hour today. We advocate at the state and federal level to ensure that county priorities are represented. And apart from our advocacy work, we also do a lot of education, strategic engagement, coalition building, all with the goal in mind of supporting clear communication of county impacts and policy solutions that support effective local governance. We love when folks reach out to us and say, I need to learn more about what's going on with counties across statewide, as different as they all are. So I think words that I've been thinking about quite a lot during this wonderful partnership with the Agile Government Initiative is our role as a facilitator, as relationship builders, as this association, this coalition in Sacramento of folks that we can really represent the diversity of counties statewide and build some really unique partnerships. So for those of you who haven't been to the CSAC offices in Sacramento on K Street, we're actually right next door to the University of California's Student and Policy Center. It's a very cool building. They're a forum for education on politics and policy making. They have a lot of events, and they're quite literally our neighbors. So when we were approached by UC Berkeley's Agile Government Initiative earlier this year, and sort of an extended family member of our neighbors, the UC Center, they said, hey, we want to learn more about county government and effective local government. How can we do that? And learn more about the incredible work the counties do on behalf of California residents. Now, that was music to my ears. That is one of the reasons that CSAC exists, to be that facilitator. So I'm so excited for this partnership and to welcome you all today to hear about some of the work that they've been doing. And I'll put my email address in the chat if anyone has any other questions about CSAC. And with that, I'm going to go ahead and turn it back over to our distinguished partners.
All right. Thank you so much, Jessica. Well, I'd like to introduce myself. My name is Dr. Shannon R.I.S.E, and I'm at the Agile Government Initiative at UC Berkeley. I'm also a former senior advisor to the White House Chief Data Scientist, and also I am a former Medi-Cal beneficiary. I will reach it on over to my Deputy Director, Jed Herman, to introduce himself.
Hi, everyone. Thanks for having me here today. As you can see on the slide, I formerly worked at the White House Office of Management and Budget and then worked on the U.S. Treasury COVID recovery team, including implementing the state and local fiscal recovery funds, which many of the county folks on the phone will be familiar with, since that provided funds to every county in the country, including all those in California. Thanks for having us and joining us today.
And I'd like to pass on over to our research team to also introduce themselves.
Hey everyone, my name is Sanaz and I'm a second-year Master Public Policy student at the UC Berkeley Goldman School. I joined this project because I think this is such an important moment for health and social policy, and I wanted to learn how to apply agile, responsive policy tools in real time.
Hello, everyone. Thank you. My name is Godwin, and I'm also a second-year Master of Public Policy student. And I joined this project because I have an interest in the local economic development. And this project has contributed to broadening my understanding of the technicalities involved in the field. Thank you.
Hi, my name is Emma Fulweiler. I'm a second-year Master of Public Policy student as well. I wanted to work in this project to help create useful tools for counties to rapidly understand and be ready for policy shifts.
Thank you. So with that, the flow of today's webinar, we just had our welcome and orientation, and we're going to be spending the bulk of today showcasing some of our emerging insights from our county's R.I.S.E Medi-Cal project, and then move into a moderated Q&A. So as I deliver this presentation, please feel free to share your questions in the chat, and then we will attend to them at the end. So to start us off, I wanted to share the origin story of this project. So this is a new initiative at the UC Berkeley Goldman School, and our goal is to equip present and future policymakers and civil servants with innovative ways to deliver the right things in the right way and at the right speed, especially in times of disruption and change. And when I joined this initiative, at first I thought, there's some really great case studies of things that we learned during the pandemic of how to better deliver for communities in times of disruption and change. But then we entered into a new moment of change. There are a lot of shifts happening, especially when it comes to safety net programs that are funded through the federal government and also through the state government. And one of the things that I saw in the space, in the narrative space, is that there's a lot of attention on what's happening nationally. There's a lot of attention that's happening at the state level, but not a lot of understanding around how those policy shifts are going to impact counties. And so we thought, could we maybe design a pilot project in agile policy research to help counties rapidly understand and get a good sense of what those impacts might be so they can strategize how to move forward. And so I want to also just share a difference in traditional policy research and agile policy research to understand the ethos of our initiative. So typically for traditional policy research, it's a more in-depth, comprehensive understanding of a problem, long-term research, often a year or more rigid structured research methods with peer-reviewed studies. And with an agile policy approach, we're more focused on rapid iterative development to inform immediate decision making. We think in terms of short-term, quick cycles, weeks or months. We use flexible adaptive methods. We think in terms of pilots and prototypes and using as near real-time data as we can find, and also a really strong emphasis on emerging data and feedback that's useful for understanding the situation. Another key component of agile policy research is the need to have continuous embedded stakeholder engagement at every stage of the project. And then in terms of our outputs, instead of having these more formal reports of policy papers, we think in terms of working drafts, toolkits, dashboards, policy snapshots. And we work at a pretty rapid pace. We're very adaptable. There's going to be many changes along the way in terms of our approach and strategy. And this project has definitely embodied that. I will also say the last element, in terms of risk management, is that we do accept a level of manageable risk, and it's all about learning from failures. So that's a little bit about the ethos and philosophy of this project. So this is, we scoped this as a 12-week agile policy project. We started in May. We're wrapping up at the end of August. And we have two goals. One, to prototype these sense-making data products in collaboration with counties. And then two, to surface emerging insights on county experiences and conduct these deep dive interviews to understand what were some pre-existing challenges with administering Medi-Cal, what are some strategies that are working really well, and what are some emerging concerns. And at the outset, we will also just say what the pilot is not. So it's definitely not intended to replace or supplant advocacy efforts. And actually in this field, as you may all know, there is a very robust network of organizations in the Medi-Cal policy space that do advocacy work. It's also not intended to be a definitive and authoritative source on Medi-Cal policy research. We cite those sources for further reference. So with that, I'll invite my partner, Jed, to share out some of the remaining slides of this section.
Thanks, Shannon. I think you've done a good job of framing the ethos of this project and the background here. To make this all tangible to counties, the way to do that, particularly as Shannon mentioned, in an agile way that can be adaptive, is thinking about snapshots, right? Snapshots are, as the name implies, a moment in time looking at what is going on. And so we've taken a lot of information from authoritative sources and adapted them along the way as federal policy changes happened and state policy changes happened to produce these snapshots that are supposed to be a source of information for counties and relevant county stakeholders to learn about the potential impacts of Medi-Cal changes. And so, as Shannon said, these are not sort of designed to be replace advocacy, right? They're designed to be educational tools that are nonpartisan, give the facts, and make things information easily accessible. So make this as hands-on and easy for people to understand what these changes are and what the impacts might be. And they're written at a level that's supposed to be for someone that is not a Medi-Cal policy wonk, but people that are concerned about this, that are they're working county government or have concerns about the healthcare industry or budgets, and so designed to be easily digestible. If we go to the next slide there. So what's in these snapshots? So we give an overview of what is the current state of Medi-Cal. So what is the historical perspective on Medi-Cal, how Medi-Cal has served that given county, right? Who are the people it serves? How many? What are their demographics? And then think about what could the impacts of the policy change that are coming both from the federal level as part of the One Big Beautiful Bill Act, which had a lot of changes to Medicaid, which is the national version that Medi-Cal is a part of. And so think about what those changes could be. And there are also potential changes coming from the state of California as well. And so think about what are the impacts of those potential changes this year. As Shannon said, this is agile, and these changes have been coming over the course of the project. We actually started the project in May before the One Big Beautiful Bill passed. And so there've been a lot of analysis. Now the bill is passed and there's additional analysis. And so we've been continuously updating these snapshots, and a strong shout out to Emma, Godwin, and Sanaz for their work on very much iterating and changing as new information came out. And so population impacts, but so not just the people, but then also the health system impacts, right? Medi-Cal is a huge funder, as you'll hear in the rest of this presentation, of local county health services, hospitals, doctors, et cetera. And so looking at what the system level changes are, and then all of that has an economic impact on the state and on counties, right? Healthcare industry is a big driver, economic driver for the state. And so trying to think about what some of those impacts were. And again, as noted in the parentheses here, drawing from the definitive sources, people that are doing that analysis. And so one of the ideas of the snapshot is to put lots of information from disparate places in one spot in an easily digestible way. If you go to the next slide. And so how do we produce them? Shannon talked about the iterative nature of this work. And so it really has been looking for data sources that are authoritative. So that was step one, right? Was gathering information about what these sources were, looking to the experts for them, trying to understand, and then putting that information in easily to understandable forms. You know, images, graphics, charts, other ways that can make this stand out. And so we prototyped some early versions, did some testing with a small set of counties on that. Now we're continuing to iterate and share that prototype with a larger group of counties and other stakeholders as well to get their feedback. Again, this is the agile ethos of building a minimum viable product and then iterating on it over time based on feedback from users. Go to the next slide. And so here's the workflow, right? And so been working with CSAC and with counties on producing these snapshots. As you can see in step 2, did a version 1, right? We met with counties to get their feedback and go back and do a version 2. Again, then go back and do a version 3. And so all along, as you can see in the cycle, counties have been involved in this and reviewing this information. Because obviously you all that are on the line here that are staff and counties understand better than anyone what the situation is on the ground in your county and how Medi-Cal is supporting your residents and what it means for your county. And so getting that feedback is really vital to this snapshots, to this project, and to the agile policy approach, which is incorporating stakeholders throughout the process of producing this. And this county snapshot workflow illustrates the degree which we've been engaged with stakeholders. Go to the next slide. And so we've also been hearing from counties, these are tremendously valuable tools. They can really help them in their communication, planning, and advocacy efforts. And so they can use them, as I'll go through in a second, across a wide variety of audiences to be a definitive, easy to understand source that is also tailored to the local context, because each of the snapshots not only has statewide information, but information exactly on that county and the populations being served and the impacts in that county. So a very useful source we've heard from counties for them to be able to put all this information in the local context. On the next slide, here are some of the specific uses that counties have talked about, right? So educating decision makers, that can be both decision makers within their county, so boards of supervisors, elected officials, but also others, decision makers at the state level as well, right? And the next one there, so that can support their advocacy efforts with the state legislature or with others to talk about what these impacts are in their counties. Also for use internally, right? Informing staff across departments, either those that are working in the health space, right, and may have a very small slice of Medi-Cal or very small slice of this work to help give them the global picture of what do these impacts actually mean when we talk about changes to Medi-Cal or Medicaid at the state or national level. This is a real way to manifest and talk about that in concrete ways. And so useful for internal staff also to understand how their corner of their program or their initiative they're working on can fit into this overall comprehensive whole, which is Medi-Cal. If you go to the next slide there. Another use we have is obviously communicating these publicly, right? So talking to other stakeholders in their counties, their constituents, the media, others to talk about what are the impacts that we could be facing here, and to help them understand what kinds of decisions counties are going to have to be making, right? One of the things in my experience in government, and I've worked at and with all levels of government, from local government up to the federal government, is I found that when people can understand the background and the facts and the data and the decision points that governments are facing, it's easier to understand what those how decisions are being made and what the ultimate decision is. And so understanding the pieces that are going into that is a very useful tool. And that's what the snapshots endeavor to do, is to make this concrete in ways that can help people understand what decisions the government is facing. When you hear about a $1 trillion cut in Medicaid at the federal level, what does that really mean for Contra Costa County or another county in the state? So the snapshots help do that. And it says at the bottom here, so it can support conversations about that. Go to the next slide. And so, as I mentioned, we've been doing a lot of stakeholder engagement. And so these are the types of folks that we have been talking to in counties, right? So both people that are definite experts in this, like health services directors, but also people that are working outside of the county space, right? That maybe manage care plans or hospital CEOs and CFOs, or legislative people that understand the legislative or policy aspects of this. And so trying to get it as diverse set of stakeholders as possible to provide feedback on these snapshots and provide information on what the situation is the counties are facing at this time. Next slide. And as I mentioned, connecting with experts. So a whole group of experts, and Shannon mentioned at the top, that are really understand this space well, and provided tremendously impactful and important feedback for us as we've been putting together these snapshots, and are a real resource for counties in understanding and navigating these types of changes. Next slide. And so, there have been some challenges in this work. Number one, obviously, is the shifting policy landscape. As I mentioned, we started this work before the One Big Beautiful Bill had passed. And so there was a lot of speculative information about the version that could pass Congress or what the House of Representatives had done. So the policy landscape has definitely been shifting and will continue to shift as this law enters implementation. It's also a complicated domain. There are many different stakeholders in here, right? Both at the state and federal level, many policies, many departments that impact this. And it's shifting, right? Over time, we've seen over the past just life of this project, how the narrative is shifting and how different changes at the federal or state or local level are impacting the way that people are talking about Medi-Cal and the potential changes and what that could mean for counties or not mean. And then there are obviously the differences. Every county is doing things a little bit differently, right? One of the beauties of a program like Medicaid, right, is it's flowing from the federal level, and there's management at the state level, but then also management at the county level. And so counties have a decent amount of control over the way they implement this work, and that looks different in every county. And so we've tried to reflect that in the snapshots. Doing personalized snapshots for each of the counties allows us to be able to reflect some of those county level differences that we're hearing about through these stakeholder engagements and our research. Next slide. And when we consider, what it is we're learning on the way here, right? There are lots of different needs that people have doing this, right? And so, as I mentioned, you all working in counties, you're managing your local level, you're managing your state level stakeholders, so you're thinking about how snapshots in this project can help support you in that work, right? You have needs in the organizational space, right? Who else is doing this research, what their intentions are, what role they might play. So there are lots of different stakeholders in this place. Again, the snapshots are trying to support your work to engage those stakeholders. And then, there's lots of data out there that in some cases people feel sensitive about or want to control about what this means in these counties. And so we've tried to balance thinking about how we can make sure this data, which is important in the public domain, can be out there, but in ways that is going to support the types of decisions and processes that counties are having. So that's some of what we've been thinking about as we put together these snapshots and do this project. So with that, I'll turn it back over to Shannon with another big thanks again to Emma, Godwin, and Sanaz for all the work they have done in doing this iteration over time as the policy landscape has shifted. Shannon, back to you.
Thank you so much, Jed. So with that, we want to spend the rest of today talking about some of the insights that we've gleaned from our county interviews. And here are some of the questions that we asked. Just to change the tenor a bit, we were curious to understand, before these federal and state changes, what's been working well in counties with Medi-Cal administration? What are county strengths? And then we want to get a sense of what were some pre-existing challenges that counties were experiencing. And then looking forward, what are some emerging concerns? And then feedback loops. What does feedback loop look like with state level decision makers? And what does collaboration look like with other counties related to Medi-Cal? So here are some of the emerging themes so far from our work. So in terms of county strengths, what has been working well? One thing that came across really clearly is that counties rely on trusted partnerships to do outreach and enrollment, especially for hard to reach populations. And that means in partnering with their community messengers, food banks, outreach workers in different communities. We appreciate this quote here from a county. Our partnerships with community-based organizations are the only reason we can reach certain populations. Some people will never come to a government office, but they'll talk to a trusted local group. Another strength is that there have been many improvement projects happening at the county level to improve operational efficiencies for eligibility work. So many counties have implemented no wrong door approaches where clients can apply for multiple programs, multiple safety net programs through a single point of contact. And that means in order to do that well, they've had to cross-train staff across programs. And this also enables them to shift the workload dynamically between teams, prevent service bottlenecks. And then we've also heard from counties that there's been some work around call center optimization to make sure that eligibility workers have time to do uninterrupted time to process cases, and then to focus on the multifunctional call center when they have the brain space for that. So another key strength of counties right now is that they rely on multi-agency and multi-county coordination to align service delivery. And a lot of these networks were set up during the pandemic era to facilitate communication and coordination. And they've kept those networks up and running because they found so much value from having those folks come to the same table to share updates and coordinate delivery across services. Another strength that we've heard is that many counties have been able to deploy innovative service delivery approaches, particularly for populations with complex health needs, whether that's street medicine teams or community paramedicine. So really going the extra mile to meet folks where they're at to ensure that they get the benefits that they are entitled to. So before the state policy changes and the Fed policy changes, what challenges existed for counties? I'm sure some of these challenges are not new to the folks on the call. One is access to care, particularly in rural counties. We heard several times that provider shortages have been a challenge and will likely continue to be a challenge moving forward. Provider reimbursement rates still remain a concern, as well as long distances to reach care for residents in remote areas. And we have this quote here: with per beneficiary rates so low, providers have to limit how many Medi-Cal patients they can see for preventative care, which means more people end up in the ER. Another challenge is that even though there's been a lot of improvements in some counties to improve operational efficiencies when it comes to eligibility, in other counties, there are challenges related to high turnover and vacancy rate. Also, eligibility work can be quite complicated. Sometimes it's very challenging to train people up to do this work, as well as find folks who can help cross the language barrier. We have this quote here from a county: every county is fishing in the same pond for staff, and in rural areas, it's even harder to recruit and retain. So with the Fed and state policy changes, what are some emerging concerns of counties? One, budget pressures. So there are concerns related to the loss of MCO tax revenue, reduced federal match, need to maintain staffing levels with flat or declining budgets. We did hear from some counties that are exploring local funding measures. Others felt like that was not going to be something that was viable for them, and didn't want to be put at a disadvantage with any strategy that was focused on revenue streams that could lead to differences between counties. There's also confusion about work requirement implementation. How will this be defined? What types of activities will count? How monitoring will occur? How counties will track compliance? All of that is very much up in the air. That said, there is alignment that counties anticipate that the work requirements will disqualify many working individuals who, for a variety of reasons, may not meet the hourly threshold. There are also concerns about increased ER usage. They expect to see a rise in uninsured patients seeking care in ER departments. For counties that run hospitals, there's concern that private hospitals may refer or divert more uninsured patients to county facilities, increasing strain there. There's also a concern related to requests for disenrollment or fears of enrollment. So some counties are reporting a rise in fear and confusion among clients about continued eligibility. Some counties noted that they are seeing a decline in appointment attendance. And then we also see some counties start to anticipate coverage loss. So counties are analyzing their local enrollment and eligibility data to see which populations may be at risk and to proactively address that. So we have this quote here, we're looking at our data to proactively identify who will be required to meet work requirements and see if there are some strategies there. And then also concerns about eligibility, staffing, and capacity constraints. Nearly all counties we spoke to expressed concern about not having enough staff to meet the increased workload for eligibility, requirement compliance, and some are already proactively hiring and ahead of anticipated attrition or thinking about how they can adjust their call center hours. Lastly, we asked about what feedback loops exist between state and county stakeholders. And we heard that the role of state agencies, intermediary groups, and associations are critical, and that counties rely heavily on their industry associations, their state agencies. There's regular communication with DHCS and CDSS. Counties are noting there is a lack of concrete implementation guidance from the state. The ongoing verbiage at the moment is let's wait and see what the feds say, and then we'll respond accordingly. And we hear that counties are preparing for future rounds of legislative advocacy. Some are working directly with their state and federal lobbyists. We did hear one quote, in rural areas, it's not compete, it's cooperate. Everyone knows we won't get through this without working together. And we thought that was a really apt quote to end this part of the presentation. So with that, we wanted to open it up for questions. And also we have some questions for counties. Are there any counties present that we interviewed? Would love to hear from you if so. Also, what insights did we miss? We recognize again that we're still in the process of this project. And we'd love to hear if there are other things that's working well in your county or other emerging concerns. Also, we have an opportunity to start to think about what does a roadmap look like for the future for counties. So if there are ideas that you may all have, please let us know. And do appreciate already like some of the questions in the chat. Yes, definitely. There's a question there about there are counties that don't have high turnover and eligibility. That is very true as well. So we're apologize if that came across to be the case, but no, there are counties that that are actually very well staffed at the moment. And Jessica will be moderating our Q&A for us.
Yes, everyone, please feel free to put your questions into the Q&A function if you would like. I do see one person with their hand raised. And I can allow a comment from Sheila if that works for everyone. Okay, Sheila, go ahead.
Hi, sorry. Supervisor Sheila Allen from Yolo County. Sorry, I'm driving, so can't write in the chat.
I'm sorry.
I joined late. Sorry, but I'm really interested in the subject. I'm wondering if Yolo County was a participant. I don't know if we were. Do you know?
So thanks for asking. We did put out a call through CSAC for those counties that would like to participate. And so we were able to accommodate the counties that raised their hand during that time period. I think for my research team, if you can confirm for us, we can get back to you, Sheila, on that question.
Okay, just because we had a number of leadership changes, so it might have been lost. And then, sorry, and if we didn't participate, I'm sorry, because I really want us to be a part of it. Also, I'm a public health nurse, so this is like my thing. Is there a way for us to how do we request a snapshot? Because I would really love to have that information for our community.
Yeah. Thanks so much for letting us know, and we will get back to you on that. thank you so
Okay.
much.
Great. Thank you.
Thank you so much, Supervisor Allen. All right. There is I see a question in the chat and a question here in the Q&A function. All right. So we have a question here. Is the presumption, or is it known that work requirements would be adjudicated at the county level, not within a statewide system? And I believe, and I can, someone else please chime in who may be more knowledgeable, is my understanding that we are still waiting on definitive guidance from either the federal government or the state government. And we do have a question here in the chat, sort of a lengthy question. I think you and your team should be able to handle this one, Shannon. What is the math on determining likely disenrollment numbers and which populations are at risk? And yes, I do agree. Lots of various numbers, lots of folks chiming in space, KFF, the governor's office. So do you have any comments on that and your insight on that, Shannon?
Yeah, so as I mentioned, we are collating from those in the field that are doing original policy research on this and bringing together insights from those sources into the snapshots. And at the moment, we do not have any specific numbers related to disenrollment, just because we haven't really yet seen authoritative, definitive numbers at the county level. And so as the chat, as our commenter mentioned, there are various numbers coming from various offices, and so we look to them to be where we those are all authoritative sources, but we're not in the position of adjudicating which one is the most authoritative source.
Do you have any other questions? I'm looking for raised hands. I'm looking for questions in the Q&A. Oh, we do have a question.
Hi, can you hear me?
Yes, we can hear you.
Okay, thanks. So it's more so a comment related to the last question on this slide about where would we like to see future research. I would just like to comment, I really appreciate what you've done here. I think it's really valuable and helpful. And one thing that would be great to see in the future, if feasible, is looking at the changes, the policy changes for Medi-Cal and CalFresh. I'm from Human Services Department. From the client's perspective, meaning as we're trying to communicate with our community partners and internally, we as systems, we often look at program. Here's what's happening in Medi-Cal. Here's what's happening in CalFresh. But to the clients who are receiving the benefits, they don't experience them separately. And so we're trying to think about how we can demonstrate changes from that perspective. And I haven't quite seen that yet. We're beginning to try and put together tools, but that would be really helpful in the future, if that makes sense.
Oh, it absolutely makes sense. Thank you very much for sharing your perspective, Kimberly. I don't know if I can direct the future research of Shannon and her team, but I'd be happy if you continued studying California counties in perpetuity.
Yeah, I mean, there is a robust health policy research space, and so to the extent, even in our case study that we are able to put out there, if we're able to at least nod to future directions that can help to inform the work of other research organizations in the field as well.
And While we're waiting for other folks to type in their questions or raise their hand to provide comment about insights from counties or what's working well in their county, I would like to know what was most surprising for you. Going from the beginning of this concept and your research plan, and after going through all of these interviews and meeting with so many different counties from across the state.
That's a good question. I would say that I I was um, I was surprised to learn about all of the incredible ingenuity that has been put in place to improve operational efficiencies of eligibility work. I mean, eligibility workers are under a lot of pressure. It's it's high stakes work, and it's very complex work, and counties have been doing a lot to simplify that work and to onboard folks in a way that helps them develop a strong level of competence over their role. And we heard time and time again about how much thoughtfulness and care goes into making sure that eligibility workers are set up for success.
I agree. Thank you. Our unsung heroes.
Mhm.
Absolutely. All right, I'm looking for additional questions. Anyone would like the opportunity to raise your hand, provide us with some feedback? And I know that personally, when I attend webinars, I usually think about it a little bit afterwards, and then I have more questions that occur to me later in the day. So you all have our contact information. Um, oh, yes. Okay, I see we have a question. Um, Information regarding the anticipated increase in need for crisis services. So is this a request, or I'm not
Yeah, it sounds like it
uh,
would be a request.
yeah,
Mhm.
yeah, crisis services. Um, Anticipated increase in need for crisis serv. How often did crisis services come up during your interviews?
Yeah, they came up pretty frequently.
Yeah.
Um, um, I mean, many counties have been doing a lot to make sure that their behavioral health systems and their behavioral health services work in tandem with existing health services that are Medi-Cal funded to ensure that people can get the care that they need. And so there's a lot of uncertainty about how county level behavioral services that are providing those crisis services are going to be impacted, or how they might be see increased need. So definitely um, understanding that scope, I think that would be a really helpful.
Definitely. It says, yes, the request for more information about anticipated increase in need for crisis services. Definitely consider that as a topic for future research, and certainly something that I can think about and get back to you,
Yeah, and
Teresa.
the CMSP folks also would be great to consult with on that.
Oh, and a question about where the individual county snapshots can be viewed.
So they're all still in development. So when the counties that we're working with are still in the process of providing feedback and uh, final round of edits. And for those that choose to make their snapshots public, we will then host them on our county's R.I.S.E website, which we'll be happy to share after the call today. All right, well, I think we can wrap up for today then. What do you think, Jessica?
I think so. I am always available for questions. I kind of a chatty person, love to have a phone call as well. So I hope that folks really enjoyed our time together today. And please feel free to reach out to CSAC at any time.
Take care, everyone.